Give it up for Angela Lawrence.
Hello, everyone. First, I just want to thank Amanda and Aaron and really Riley with the foundation. Pulling together this day has been an incredible feat, and you all are amazing. So thank you so much for this. I'm really excited to be here today. So, as you heard Amanda say, I am the Director of Nursing for Behavioral Health Services. And I wanted to revisit this scaffolding, which you saw earlier when Jackie was presenting, about our service line and look at it through just a little bit of a different lens. So I transitioned into this role in May of this year with a moderate understanding of mental health and a narrow view of the services that we have here at BCH. Spending most of my frontline career in the clinical acute medical arena, I was a novice in the area of behavioral health. As has always been true in my more than 20 years at BCH, the amazing team from all of the behavioral health departments, they worked hard to get me up to speed really quickly because all of these services were steadily transforming and growing. Throughout this orientation and information gathering, my eyes were opened to a wide array of areas within our organization where the behavioral health team was partnering to provide care, support, and resources. Like some other people, I was under the misconception that the primary avenue of entry for mental health care and patients was for them to present to the emergency department because they're in crisis, and they get an evaluation, and then subsequently they have an inpatient admission. I am really happy to say that I was very wrong, and after realizing that I misunderstood the way that this works, it prompted me to amend all of my assumptions, and I wanted to make sure that the patients who are in our community didn't have that same misunderstanding. So as you've heard throughout this program today, there's not one way or no wrong door to enter and receive care for mental health illnesses at BCH. So a pivotal door, which you kind of have heard about, available for our patients, exists within their current BCH doctor's office. Our behavioral health specialists embedded in the primary care clinics are a very important part of the team, which I don't think are very well known. These licensed professionals can collaborate with the medical practitioners to create treatment recommendations for the established patients. This partnership allows patients to receive holistic care, including therapeutic interventions and learning coping skills alongside their regular medical visits. Having the opportunity to get connected with these therapists in their familiar medical office without any extra steps is key to helping patients access mental health care. When necessary for patients, these behavioral health specialists can help with referral recommendations for more targeted mental health treatment. So one such referral may be to our newly rebranded Center for Interventional Psychiatry. This department is an area in the service line available when conservative care plans have been unsuccessful. Our department offers 3 different modalities to patients seeking alternative treatments for complicated mental illness. ECT has been the primary therapy offered for severe psychiatric disorders, but last fall, BCH added TMS and ketamine infusions. After a comprehensive consultation, our providers recommend a treatment plan suited to the individual needs of each patient instead of a one-size-fits-all approach. Having all the modalities within one department gives patients hope when they feel they've exhausted other remedies. promotion of our Center for Interventional Psychiatry is moving to shatter stereotypes regarding interventional treatment methods as they're portrayed in the entertainment industry and media. These fantastical biases may be triggering for patients with serious illness and deter them from pursuing these alternative treatment approaches. Our team is working diligently to streamline the referral process to assure access to these modalities is uncomplicated. Another area to highlight is our nature-based program pathways. For a wide variety of mental conditions, this exists. Our 2 levels of participation in the program are tailored to each patient's needs and goals of care. The series offers multiple therapies and mindfulness activities while exploring the City of Boulder's open space and mountain parks trails through hands-on experiences and group sessions. This unique therapeutic approach covers many topics with patients, including coping skills, self-compassion, wellness, interpersonal interactions, and providing a positive experience in nature. The ultimate benefits for patients participating in the program would be stress reduction, connection with others, new experiences to enhance creativity, expanded attention span, lowering blood pressure, finding positivity, and a more focused mind. Pathways curriculum intends to harness our county's amazing natural resources and nature to enhance a person's overall well-being. I could probably stand up here all day and talk about all of the incredible services that we have at BCH. And when I'm passionate, I start to flail my arms and we get carried away, and then we would never get to Dr. Kromka's speech. So it's a really exciting time right now in behavioral health. And we're really eager to see some of the proposed upcoming developments come to fruition. So the first one is we are awaiting our 3.7 withdrawal management designation, as you heard from Jackie before, to augment the current care provided in our inpatient unit. This medically monitored inpatient setting for substance misuse is ideal for the following individuals: those who require treatment due to moderate or high-risk behaviors which could endanger themselves or others, those who don't have a supportive environment for detoxification, or those whose lack of awareness highlights the need for intervention to prevent continued use, to engage with care providers, and to stay in treatment. The ruling criteria for this designation employ a multidimensional approach, collecting information about different aspects of a patient's life to create a treatment plan and care goals. This is then used to help determine the next level of care appropriate for the patient to continue their journey to recovery. With a high community need evident for substance use resources, after this inpatient implementation, we ideally will look to expand our substance use services in the future, possibly to our outpatient space. Next is the redevelopment of our Center for Mind-Body Medicine, as we have recently completed our team. Utilizing a therapeutic model, we strive to empower patients with tools to improve their well-being both physically and emotionally. Grounded in evidence-based neuroscience, this treatment helps to improve stress-induced emotional and physical illness, chronic pain, and other medical conditions that are difficult to treat. We look forward to completing the redevelopment of counseling, acupuncture, and Reiki model in the next few months. And then we will be able to engage with our primary care providers to facilitate referrals for patients to access this department. Last, around the end of the year, we will welcome a medical director for our behavioral health services. Their expertise will continue to enhance the focus to our division's transformation, help to improve access to our facilities and providers, and bring further innovation to the care of mentally ill patients. All the things I've discussed that are here are really to meet that service line vision, to provide robust, accessible, innovative behavioral health services to support and enable people to live their healthiest lives. If you can't tell already, I am very proud to be a part of this team, which has elevated mental health care in an environment wrought with difficulties. I'm energized and honored to be a leader on this team in the continued evolution of our services to meet the needs of our patients and the community. We are here to open all the doors and help our patients navigate the landscape of mental health care to achieve optimal wellness. Thank you. Didn't actually ask if anyone had questions, but I am here if you do.
Questions for Angela about any of the services, how to access them? No?
And if you're as freezing cold as I am, just get up and walk around a little bit. It helps.